Hi, my name is Jasmine.
And my name is Natalia. Today we are going to be talking about a qualitative research study that was performed to examine the correlation of birth defects and cancer. The information for this study was found using different registries throughout the state of Texas. And we happened to find this article featured in the American Journal of Epidemiology.
The title of the study was called Are Children with Birth Defects at a Higher Risk of Developing Childhood Cancers? The authors of this article included Susan Carrozza, Peter Langois, Eric Miller, and Mark Canfield. We chose to review this article because it's something that we can relate to since we're in nursing school. We come into contact with children with birth defects more often since starting our pediatrics clinical rotation, so we thought it would be interesting to see what the future may hold for these kids. The hypothesis in this article was that the increased risk of childhood cancers among children with birth defects gave an indication that these children constitute a high-risk population. The purpose of the study was to confirm the increased risk involved.
According to the researchers, this was a very difficult study to perform as birth defects and childhood cancers are both rare occurrences compared to the number of normal births. The subjects that were studied were born in Texas between 1996 and 2005 and were identified through the Texas Birth Defects Registry. The researchers then looked at the Texas Cancer Registry and compared the two to find the linkage between those children born with birth defects and those that ended up getting cancer.
The results of the study were quite interesting. In this time frame, over 3 million births were recorded. Out of these, 115,686 children were born with defects, and 2,351 recorded instances of childhood cancers among them. This meant that children born with defects were 3 times more likely to get cancer than those born without.
It was also interesting to find out that all birth defects had a positive correlation to cancer with the exception of musculoskeletal defects. It was also found that children under 1 year of age were most likely to develop cancer, but as the children got older, their chances of developing cancer decreased.
A strength of this article is that it shows evidence of a correlation between reports of those with childhood cancers and those that were born with defects. By coming to these conclusions, we can perhaps gain a better understanding of childhood cancers and identify factors such as environmental and genetic factors that can contribute. Another strength is that the study was derived from high-quality and high-trusted registries throughout the state of Texas.
A limitation of this research article was the lack of death linkage in the study cohort. This could have allowed for the researchers to rule out if the child died before the study ended. Secondly, cancers that developed later in a childhood may have been overlooked since the follow-up time was 10 years. Another limitation was that the defects that are not likely to have significant on the child's life, health, or functioning are recorded only if they co-occur with one that is. Lastly, the study did not distinguish or separate the cases with children that had multiple birth defects. Future studies will look into the prognosis of children with cancer and birth defects in comparison with those that do not have defects.
The study affects public health because if we understand that certain environmental factors can cause birth defects and thus increase the risk of a child getting cancer, then people may be more careful about certain things they are exposed to while pregnant. Additionally, knowing the type of cancers that are prevalent can help with providing the correct treatment as soon as possible. Children with congenital abnormalities were found to have a significantly higher risk of developing some type of cancers, including leukemia, tumors of the CNS, tumors of the SNS, and soft tissue sarcomas. In this way, parents of children with birth defects can be given information upon the birth of their child and given a list of possible cancers that are at high risk of their child developing later on in life. They can then be taught to look out for signs and symptoms of cancer, and if any of these are noted at home, the child can be immediately brought in for assessment and possible treatment. Treating cancer right away can be potentially a life-saving measure for that child's life.
Similar studies have been conducted before that also support the conclusion. An example is the article released by the Journal of Molecular Diagnostics titled Down Syndrome and Malignancies, a Unique Clinical Relationship. In this article, there was a correlation between Down syndrome children and leukemia. Children have a 10 to 20-fold higher risk for developing acute lymphoblastic leukemia and acute myeloid leukemia as compared with non-Down syndrome children. As future nurses, we want everyone to be aware of this fact so that we can look closer at these patients that we may encounter one day. In conclusion, by looking at this study, we have learned that there is a threefold increase in cancer rates among children born with birth defects, thus supporting the hypothesis. This article was very interesting and informative. As stated earlier, it provides us with factual information that can be imperative in patient teaching. I thought the article was clearly written and easy to understand.